suggested we might kick off. I might just start by acknowledging that I'm here in Sydney. I travelled here this morning from Bidjigal country in the south of Sydney, and I'm now on Gadigal country in the Sydney CBD. So I pay my respects to ancestors and elders, and likewise extend those respects to ancestors and elders all around Australia, from wherever you might be dialing in from. I think Pat McGorry requires no introduction really to this group of people, founder of Australians for Mental Health, executive director at Origin Youth Mental Health, Australian of the Year in 2010, and really kind of an all-round champion when it comes to advocating for the kind of changes that we need in Australia on mental health. So, Pat, it's wonderful to have you along for this chat.
Well,
We
thank you,
thought,
Chris, and for that
uh,
very kind introduction. It's great to be here.
well deserved. We thought that folks would probably get some benefit, given that the election is upon us, called a couple of weeks ago, and voting will start really in the next week or so. To just get a bit of a, I guess, an insider's perspective, Pat, on the election and mental health in particular as it relates to the election and kind of what's at stake. Of course, Australians for Mental Health is very much a non-partisan organisation, so we don't offer support to any particular candidates or any particular parties. But of course, being non-partisan is not the same as not recognising that what we decide at elections, what governments decide for us, and what parliaments decide for us is critically important to the kind of change that we're looking for when it comes to mental health. So, an important time for us to really just raise our voices and make sure that everybody who runs for Parliament, whether you're part of the two major parties, you're running as an independent or a smaller party, doesn't matter who you are. If you want to be in the Parliament, our view is you should have something to say about mental health because we're in a mental health crisis. And the more we as Australians, as voters, can send the message to wannabe parliamentarians and wannabe governments that mental health is one of the big issues, one of the things that we really want people to, politicians to take seriously and to make a top priority. The stronger we can make that voice, the more effective we're going to be. So that's what we're going to talk about today in this session with Pat. Thanks, Pat, thanks, Pat, for being here with us. I'm going to just start, Pat. You've been working in mental health really for your whole working life, and your track record is well known. But I think you probably have a particularly good insight into what the particular challenges are that we have in mental health at the moment. From your point of view, what is the kind of the big public policy challenge we're experiencing right now?
Well, Chris, I think, and everyone that's listening, I mean, I think me mental ill health and mental illness are one of the top three, non-communicable disease areas, or public health problems that we should that we need to face as a country and as a world, actually. And they explain somewhere between 15 and 20% of what's called the burden of disease. In other words, that the burden of health problems in the community. And yet, they've been seriously neglected forever, really, in every country in the world, even rich countries. And so, and what we've seen was we moved away about maybe 30 years ago from the 19th century asylum model for dealing with serious mental illness, where we just lock people away for long periods, and we try to replace it with a modern system of healthcare for mental illness, but provided through primary care, GPs, and private psychiatrists, and so on, and eventually psychologists as well. But importantly, at the more sort of serious end of illness, through hospitals, and hospitals were supposed to cope with a fraction of the beds, of the mental health beds that we used to have. um, and the way that was supposed to work was we'd have very strong community-based services, other residential options in the community, um, really proactive community mental health systems, working hand in hand with GPs and other practitioners in the community. Of course, that part of the bargain was not kept. the community mental health system was never really built, and it's gradually fallen apart and retreated back into the emergency department at the state government level. And we've seen, Royal Commission of Victoria to address the broken system that, the Premier, admitted was the case down there. And in New South Wales, we're seeing the collapse of the public mental health system as we speak, with all of the psychiatrists finally deciding to leave, or two-thirds of them, because it's impossible to work in a system where you have to turn away seriously ill people every single day who need help. So it's a complete mess, that deinstitutionalization process, not properly funded, not properly respected, and evidence-based care really goes missing. Even the things that we know do work are not offered to people, and they're offered some kind of mix of too much medication, and kind of amateurish talk therapy rather than evidence-based psychological and social sort of programs, and things like shelter, and the social determinants are completely ignored, which at least you could say the old mental hospitals did provide shelter and food. Now you've got homeless people with mental illness in big numbers. You've got criminalization of the mentally ill, with many of them ending up in prison because of the lack of social care. And then I suppose at the same time as that, the main age group that experience the onset of mental ill health and mental illness, which is teenagers and young adults, have experienced a rapid decline over the last 15 years of their mental health. The main age group where we've seen this decline is in this age group, and so, to the extent that we now have 2 out of 5 young people who need professional help of some sort. So there's many aspects to this crisis. It's been a long time coming, and the fact that society is functioning so poorly, it's making people sick, and that's showing up in the young people who are like the miners canaries of society. So that's all very pessimistic and depressing. We have got solutions to this problem, and that's the optimistic part. And the only problem is, how do we get governments and communities to sort of demand that or make them actually happen, and support them in the same way as they do with cancer. Like in my family, one of my relatives has just been diagnosed with a brain tumor, and the quality of care provided to her in that situation is just unbelievably good, in every respect, and no expense is spared, no brilliant expertise available to do what they can to help her, and that contrasts incredibly badly with the way people with a serious mental illness are treated, unfortunately.
Just want to touch on, you sort of mentioned there a little bit that, really staggering number of particularly young people, but really in every age cohort,
Yeah,
just the massive increase in the prevalence of mental health conditions. And you talked a little bit there about social determinants as one way of describing it. I would I would say something like just people having their basic needs met.
yeah,
Um,
basic
and,
needs. Yeah.
we shouldn't be surprised. A person who doesn't have food or doesn't have secure work or doesn't have a safe place to sleep, we shouldn't be surprised when those people have mental health challenges. Can you say a bit more about sort of that broader ecosystem in which sort of mental health can exist, and why you think maybe it's not always existing?
Yeah, well, I suppose we looked at this. We published a whole issue of Lancet Psychiatry last year, examining the youth mental health crisis and the positive responses in many countries to try to tackle it in terms of new services like Headspace and more specialized backup systems for the primary care. Um, but we also try to understand, why is it happening? Why is it happening to us? And you know, we came up with a range of sort of mega trends, like, the housing crisis, the fact that rents and, house prices are out of reach of this new emerging generations of young people. So they've got housing insecurity. You mentioned job insecurity. Over the last 20, 30 years, the rights of workers have been eroded and casualized, and conditions that were hard won in earlier periods have been eroded, through a privatization sort of system. And you have climate change, you have the privatization of education. So you have a two-tiered education system now, which wasn't so much the case 30, 40 years ago. And you have universities that have been privatized, and you have incredible student debt. And both sides of politics have contributed to this neoliberal sort of revolution, really, which has taken us away from a more collectivistic approach to society where we're happy to look after each other and pay taxes to support each other. And so a lot of the rights, and I think you've spoken in the past about policies that are brought in that harm the mental health of people without any accountability for that. And I think that's what's happened. We've seen society become much more individualistic and haves and have-nots, and inequality is another feature that we looked at. Inequality has just gone through the roof in the last 20 or 30 years, and especially there's intergenerational inequality. So a lot of wealth transfer from younger generations to older generations. So all of these things are big changes in society, which will be hard to reverse and hard to turn around in the short term. And no political leadership and leaders seem to be interested in doing that. Although we are seeing some reductions in student debt, and we are seeing the housing crisis be at least being talked about. Whether or not the solutions are going to work or not, it's
Yeah.
another matter. And
Well,
climate change, of course, they do talk about that, but they don't seem to be getting anywhere with it.
it's such a big challenge as
Mm.
well, isn't it?
Yeah.
You mentioned, when I started in this job, I tried to read everything I could possibly read about, I think you're the one who coined the term the plandemic, 53 different reports of some kind, parliamentary, productivity commission, royal commissions, 53 different reports over the last decade or so. And when you look at them, a lot of them say really, really similar stuff, starting with we've got to see people as whole people, and your mental health exists within the context of your broader life, which is where our Every Mind Matters campaign comes from. The idea that the way that we get to a place where we've got good mental health across Australia is we're starting to respond to what people actually, including treatment when treatment is what is necessary, but also being proactive right long before people are getting sick in the first place. I mean, robo-debt is the classic example, isn't it, of a government policy that had nothing to do with mental health, but in terrible ways harmed the mental health of Australians, and
Yeah.
something that government needs to not do again. So, what do you make of the election campaign so far? There's been sort of a big announcement last week from Labor of $1 billion, big announcements from the Liberals the week before. What's your take on what all the candidates, the big parties and the smaller parties, have been saying about mental health this election so far?
Well, I think the good news is that when we produced the Lancet Commission last year, we basically launched it in Australia, in Canberra. We launched it in New York and London because it's a global issue, and we basically have been trying to point out to federal government and the opposition this when you see a 50% jump in the level of mental ill health in young people, that's got to be the primary focus of reform. And both sides of politics have built foundations in youth mental health over the last 20 years, which other countries have copied, like Headspace is the most famous example of that. And backup systems like the early psychosis model of care that exists in some places in Australia. But the foundations are sort of haven't been built on for a number of years. And they've been eroded by, I think the collapse of bulk billing, for example, makes Headspace much more depleted than it was at the start. So they need to be completely, what's the word, renovated or reimagined and strengthened. And that's what both sides of politics have committed to. Their main focus in their commitment so far has been around, young people. Labor also added in an expansion of the Medicare mental health centres, which we actually lobbied Greg Hunt for when he was health minister. It was meant to be like an adult version of Headspace, and it's actually much better funded than Headspace, 4 times as well funded. So Labor have agreed to expand them further as well, and also to put in a workforce package, which we're hoping the coalition now will match. So it's a bit of a, they are generally fairly bipartisan, and they recognise it. So they're moving in the right direction, and I think we should be grateful for that. And you can't fix this overnight. So it's going to, because the neglect's been 30 years in the making. We will need to develop stronger new workforces, and I think the NDIS has been bad for mental health because it's drawn workforces away from mental health in big numbers, because they're so much better paid in that world, and the mental health offering within the NDIS is not very appropriate really. It's and it locks out people that could benefit and could recover, and requires people to really become permanently disabled before they can get access. So I think there's been some policy mistakes there within the NDIS in relation to mental health too. So anyway, the governments are listening, I think, and I think they'll listen more and they'll act more strongly if the public, become more mobilised, which is obviously what we're hoping to do through Australians for Mental Health.
Yeah, absolutely. I might just get you to kind of say a little bit more about, I think you used the term there, the workforce issues.
Yeah,
People who are maybe not working in the area might not know what you mean by that. We're really there talking about people in the range of jobs that deliver mental health care, right?
yeah. Well, it's sort of a complex issue. We need a much bigger workforce, but that means that there have got to be services funded for them to work in, rather than them all just draining out into private practice and working by themselves in isolated private practice land, which and funded by fee-for-service systems, which involve high co-payments, which made the service quite inequitable. They're not accessible to every Australian in the same way, and they're concentrated in more affluent areas as a result. So that's not the solution, to boost and expand the so-called private system, which is obviously subsidised by the government, but not to the full amount. And the co-payments are getting bigger all the time. In fact, the co-payments for young people are now 3 times what they are for older people. So that's another way that young people are discriminated against by that fee-for-service type system. So what we need to do, and it's kind of low value healthcare in some ways, because individual private practice can help a certain cohort of people, but it can't help other groups of people who need team-based care, who need, like, a psychiatrist working with a team of other allied health professionals, and even vocational recovery experts and so on, social forms of treatment. So the model of care of individual private practice will take you so far, and it's inequitable. But and a lot of people gravitate to it because it's a much more sustainable life for a mental health professional working in their own practice than it is working in underfunded, demoralized public systems of care, which is the problem with the New South Wales health system at the moment, and that's why they're all resigning. So they do have an option; they can go into private. But I would like to see governments attract these highly skilled people back into a more equitable, salaried public health system. And there's a place for the private world as well. Of course, I'm not saying that they're not doing good work, but it's not the best use of our resources as the mainstay.
Yep. Just on that, so Labor made an announcement last week about increasing, as you said, the Medicare mental health centres, but also creating a new type of sort of specialist youth mental health centre. What's your take on that?
Yeah, well, maybe I'll start with the youth mental health, because that's what Origin has been working on for 20 years, developing a comprehensive specialist, team-based system of care, with all components available to young people, to back up the primary care level of GPs and private psychologists, so that, better access people at the one, and also headspace centres, because you know you can get, for mild to moderate problems, you can definitely benefit from that more shorter episode of care in primary care. But like with every significant persistent area of health, like whether it's cardiac disease or diabetes or cancer, you need the specialist teams to be available as backup for the more complex cases, which is at least 40 or 50% of the people presenting with mental health problems. They need team-based care. So these youth specialist centres are based on a more specialized, diagnostically streamed model, so that people with anorexia can get expertise in eating disorders. People with psychosis can see people who know how to treat psychosis in a scientifically based way, in a team-based way. And same with complex moods, same with ADHD, same with personality disorders and so on, substance use. You need more specialized expertise than a generic sort of primary level. So that's what they will be, and they will be the blueprint sort of, or prototype is there, but it's going to be refined by a Department of Health co-design process over the next couple of months, which will provide some guidance and recommendations to government in implementing these youth specialist services, of which they will ultimately be 20. And they're building on the eight early psychosis services that already exist in some regions of Australia, and they can be expanded, and then new services, put on deck to back up the primary care. So I hope that makes sense. It's like a
That's
it's
that's a
like a
great answer. And
two-tier.
actually, there's a question from one of our audience. What is the future of Headspace or Origin early psychosis services under a re-elected Labor or a new coalition government?
I think they both, so Headspace provided, proposals to both sides of politics, and Origin did too. And I think in some shape or form they will be implemented. Those and on the Headspace side, it means strengthening the Headspace, because Headspace only receives $1 million per centre for operational costs and to support clinicians, and the rest of it has to come from MBS funded, fee for service. um, but the adult version receives 4 million per centre. So the plan is to bring at least 30 of the existing headspaces, especially in outer metropolitan regions, up to a more closer to the level of the Medicare mental health centres. So maybe they'll receive more like $3 million a year per headspace centre, and they'll be able to employ salaried staff. It'll remain free, the service, but it won't be dependent on providers that have to bulk bill. It'll move away from that model a little bit. So it will definitely expand free mental health care to many more people, especially in those outer metro areas where the private practitioners are much more hard to locate, and yes, so it'll improve equity in the system as well.
Now, there's been one of the announcements the coalition have made is about restoring the 20 Medicare funded psychology appointments.
Yeah,
And that, there seems to be quite a wide range of views across
yeah.
the mental health sector on the pros and cons of that. What do you see as the pros? What do you see as the cons?
Well, that is a great question, because it's been very controversial, that one. Um, the pros of extending that to 20 sessions are that the subgroup of people that clearly need more than 10 will be able to continue on. And the sessions will be more effective because they won't have to be spread out over the whole year with a month or so gap in between, which weakens the power of the psychological therapies. Um, but to think that is the solution to people with more persistent illnesses on its own is the weakness of it. But coalition have actually committed to other models too. So it's not as though they're putting all their eggs in that basket. I think it's fair to say that the argument that if you provide more sessions to people with the same size of workforce, you're going to reduce initial access. That's one of the cons of doing that. But it wouldn't be all of the people that have sessions would extend out to 20. It'd probably be, a minority, maybe 20%, that would need the 20 sessions. So it's trade-offs really. But the secret is to expand the workforce in that space, and also I think to link them into much more team-based care, and have a much stronger focus on the federal side of the equation, on salaried models of care and centre-based or platforms of care, not necessarily just centres, but platforms of care with outreach and other features, including addressing psychosocial and digital aspects as well, weaving those in too. So I think modernization, sophistication of the system, making sure that we provide evidence-based care, high value mental health care, not low value care. And someone asked a question in what did I mean by amateurish talk therapy? What I mean is um, making sure that the people who are delivering psychological and psychosocial interventions are required to use evidence-based techniques and strategies, and not just unskilled or generic sort of supportive type care, because we can do an awful lot better than that.
So we've got just in the last couple of minutes before we wrap up. Election day is about 2.5 weeks away. Polling opens in a week. What do we need to do right now to make this stuff top of mind for the folks that will go on to govern us for the next 3 years.
Well, maybe some of the things that the current policies haven't addressed, could there still may be time to get additional commitments, and I think some of the social determinants, the housing policy. I mean, people with serious mental illness need, social housing. They need somewhere to live. It's a housing first policy. You can't treat people who are homeless or on the verge or have housing insecurity. So commitment to um, public housing, rather than just improving home ownership. That seems to be where the housing policies are going at the moment, improving access to first home buyers and making that more possible. But um, this is a different set of housing needs, and Alan Fell's created the Haven model, which is the sort of thing that could be much more rapidly scaled up, I think. So housing would be one thing. I think vocational recovery. That's another social form of treatment which can complement the more clinical types of treatment like medication and therapy. Um, Vocational recovery is very effective in helping people who are recovering from mental ill health to re-engage with work and study. And you get a tremendous return on investment for that. And that's only available in a minority of headspace centres, for example, and in hardly any public mental health centres. So I
And a
think,
hugely contemporary issue here in New South Wales, where there's
yeah.
some proposals by the state government to quite radically change the way workers' compensation works for people with psychological injuries.
Yeah, yeah. But I think more generally, the thing that you mentioned, not just here but in other forums, that making sure all policies have a mental health lens cast across them, and so that um, and to see mental health as a human right, and something that everyone should have equal access to. That like we would say about education and healthcare generally. We should have a universal health system that includes mental health and doesn't treat it as the poor cousin.
Yeah, that's exactly right. And if you're one of the folks on the call right now wondering what you can do between now and polling day, there's three things that I would like you to do if you haven't done them already. One is you can jump onto our website at afmh.org.au/election 2025, and you'll find the Vote Your Mind Action Centre, um, where there's a few different things that you can do, but one of them is you can sign the petition to ask the next Parliament to take seriously some of these proactive measures, but to do things like guarantee that everybody gets quality mental health care when they need it, where they need it, at a price they can afford, commits to actually listening to people and going local, listening to communities that, on the off chance that the people of Alice Springs have different needs to the people of Byron Bay, which are different again to the people of Bondi Junction. What does each community need for better mental health? And to start to be proactive about some of these things that are the drivers of mental health. So that's the petition. The other thing you can do online is we've got this great tool. You can see, type in your own address, have a look at the mental health statistics for your electorate. It'll tell you things like how much are the typical out-of-pocket costs that people have got, what is the prevalence of mental distress in your area, statistics like that. But then you can email everyone who is running for Parliament in your electorate and ask them to say, well, what are you going to do? If you want to be our local MP, I'm not advocating who you should vote for, and I won't do that. But if you want to be our MP, what are you going to do about mental health? Will you make a commitment to advocating within your party, if you're part of a party, within the Parliament? Will you listen to the community? Will you come and have a meeting with Australians for Mental Health members in your electorate about the needs of that community? And then the number one thing that you can do is join us. If you're not already a member of Australians for Mental Health, it's cheap as chips. It's $7.50 a month. That's the full freight. If you're low income or concession, it's half that. But for really meaningful social change, we really need to build up this movement of people who are advocating for it. It's brand new. We're really just getting this off the ground. But really the idea is to raise up the voices of Australians, community by community, to make a difference on mental health. I want to thank you all for joining us tonight. That's all we've got time for. This was always going to be short and sharp. Thank you so much, Pat, for being our guest for this special election briefing. But we're going to hope that we're hoping that over the coming months, we're going to try to do this regularly and just have some sessions, just short, sharp sessions, hopefully that you'll get something out of and things you can invite your friends to have a look at as well. If you've got topics that you'd like us to cover, please just shoot me an email, chris@afmh.org.au, and we'll see if we can line up guests or people that you'd like to hear from. But yeah, over the next few months, we're hoping that we'll just do a regular set of these online sessions in addition to all the other things we're doing as Australians for Mental Health. Thank you so much again for joining us. Enjoy the rest of your evening and make sure that you jump onto the website and have a look at that election centre and join up. When you finish this call, you're going to get automatically diverted to the website. So you'll be able to do all the things you need to do straight after this call. But thanks everybody, and have a wonderful evening.